We have had some great speakers, so bear with me a little bit. I may take this down a level, but we're going to call this the amateur hour with Human Services, all right? But thank you for having me, and congratulations on this. I really appreciate it as a departmental level Human Services executive. You know, when we go before our Board of County Commissioners in Pinellas County, it's really important that they have a general understanding of how Human Services works in the county and what we do and why we do the things that we do. Yeah, I think it's very fitting too that Human Services is tags right behind safety and emergency services, or safety services in the county, because there is so much of what we do in Human Services that we have to keep our minds framed in that it relates also to the safety services and the sheriff's services and the other operations. You can tell from the previous presentation, they talked about medical costs. We're all about medical costs. We talked about behavioral health care, homeless services. Homeless, big problem with the jail. Different policy decisions, all of these wrapped together between what you're seeing in your Human Services area and your safety services and the emergency services. So with that, I am with the Florida Association of Counties Health and Human Services Administrators Group. I encourage your counties, if they're not already participating, to get involved with the Florida Association of Counties Health and Human Services Administrators Group. It's a great peer group that we get to share information across the county and across all the state of Florida. I want to give credit to Ann Arnold of Lee County, Stephanie Myers, St. Lucie County, Lynette Hebert of Sarasota County, Claudia Tuck of Palm Beach County, Susan Harbin with VAC, and Lisa Hurley with VAC, all of which took some time to review the slides that I'm putting up and presenting to you here today. So, and they helped fact check this for me. So, the slides have been fact checked. What I say, let's just say it's Clark's opinion. We're going to focus today on a certain aspect of Human Services. You may recall the CEN process that the first speaker talked about. Well, there may be up in the C area a subcategory called M, mandated. This is the things that are written into the Florida statutes that every county has to do. And many of those things that are mandated fall within the Health and Human Services area. So what I'm going to do, and since these mandated affect every county in the state of Florida by statute, we're going to focus on these areas because these are the things that we have all in common. Now, if you look across all the counties in the state of Florida, Human Services is handled very differently. But these things we all have to deal with. We may deal with them differently, but we all do have to deal with them by Florida statute. First, indigent burial and cremation. Section 406.50 through 52 Florida statutes covers indigent burial and cremation. It talks about the final disposition of unclaimed or indigent bodies not accepted by the anatomical board. That, and different counties will handle this differently. I've heard counties use churches to help. They have different relationships with funeral homes, but essentially referrals for this program will come to you through hospice, local hospitals, medical examiner's office, or funeral homes. And again, procedures may vary by county to county, but we all have to do this, and for the most part, most counties are moving towards a cremation-based system. Increasingly, counties' policy heavily favors cremation. Some counties are reluctant to adopt cremation because of the potential for lawsuits, but it is covered. In fact, even the Veterans Administration accepts cremation as a way of disposition of veterans' bodies. And a statute change in 2013 actually gave more authority for commissioners to determine policies and procedures for the disposition of those bodies. Before the final disposition of unclaimed remains, we have to focus on doing three things that are statutorily required. The first is to identify the decedent. Normally, this isn't a problem. You usually know who they are by some identifying measure or such. The second, though, is to locate and contact any relatives of the deceased person. For the most part, relatives are available. You can generally find them. We have a very connected world today, the internet, background checking, that kind of deal. But the problem is the county, the relatives, for whatever reason, may not choose to accept financial responsibility for the disposition of their family member, in which case it then falls upon the county to do. Now, sometimes the individual may have some sort of plans through the nursing home or through a funeral home to take care of themselves after their time has come, but the last thing we should do in the county is check whether or not the person is eligible for burial in the National Cemetery, meaning, were they a veteran? Do they have this as a veteran's benefit for them? If they do, then you don't go through the cremation process. You might go through the burial process, and essentially they prepare the body for transport to the cemetery. In Pinellas County, one of the issues we have with this is that we are supposed to make bodies available to the anatomical boards. Problem is the anatomical boards want bodies that are within 2 days of deceased, of dying. I guess they like to work with fresh bodies, and which makes sense. But the problem is this leaves very, very little time for the county staff to actually do our due diligence in checking to see that the relatives of the people are available. So this little bit of a conflict that we end up working it, but generally you keep a good relationship between the funeral home and the anatomical board, and it'll work itself out. Section 409.915 Florida statutes talks about Florida and how Florida is one of 22 states in the nation that require counties to participate in the cost of Medicaid. You may recall Medicaid is known as a federal-state partnership for the delivery of medical care for a variety of people eligible, primarily low-income and children. Elderly being primarily focused with Medicare. Medicaid, though, each county is required to pay certain portions of care, and this amount has changed. Until 2012, the state of Florida required counties to reimburse the state for a portion of care for eligible county residents. The way they calculated this was they took a percentage of the cost of providing inpatient hospital care and a percentage of the cost of providing long-term care in nursing homes. The billing process was, to say the least, very cumbersome and complicated, and it required a lot of cross-checking of data between the Department of Children and Families, who made people eligible for Medicaid, and the Agency for Healthcare Administration, who actually contracted for the services. Together, they had to marry the data together and use it to bill the counties. Like I said, this became very problematic because the two agencies had two different purposes in mind. But in 2013, the prior billing system was replaced. Reason it was replaced was because the state of Florida moved from paying on a per diem basis counties to hospitals throughout the state of Florida to what's called the DRG basis, diagnosis related group. Very similar to the way that Medicare pays for care and services under the Medicare program. With that change in the process, the billing system that the state of Florida had established to bill the counties essentially was no longer viable. They couldn't use it. So we had to come up with a new way of sharing in the costs with the state. What we came up with and what the legislature passed was a percentage share based upon what prior contributions are. And what the state's doing is they're moving towards an enrollment-based system. So the enrollment allocation, they take the enrollment base throughout all the counties and they break it up into a percentage allocation. And your county, based upon its enrollment of people in Medicaid, will then pay its share of the cost of all the counties into Medicaid. That total amount, that share amount, adjusts each year by a percentage of the change in Medicaid costs at the state level. I hope I'm doing this right. But this caused a bit of a trauma effect on a number of small counties, or smaller populated counties. And the financial impact was going to be extreme in some of these cases. So the legislation adjusted to make this a 7-year period of adjustment. The last 5 years of that adjustment, we're going to slowly move from what was the previous basis of allocation to what will, in the future, by the year 2020, I believe, we're going to be on a full enrollment based. So what happens is the state of Florida takes a picture of its enrollment base as of March 1st each year. By June 1st, the agency calculates that enrollment percentage and sends it out to all the counties. As a former budget officer, this was a huge, huge improvement over the previous billing system, because at least now we know how much is it going to cost us. We can budget and tax accordingly so that we know how much we're going to be paying. You're not going to overtax, you're not going to undertax. Get it right every time, the first time. Beginning in 2016, this year, we're starting to move towards this shift to enrollment based, and during the shift period, those 5 years, the total amount is going to grow at 50% of what the state amount grows at. Once the shift period is over with, the total due from the counties is going to grow at an equal amount, percentage increases to the state share of Medicaid. In 2016, 50% amounted to 1.368% increase. For each year after 2020, fiscal year 20, the total amount of the county's annual contribution is equal to the amount of the state Medicaid. Although the multi-year transition intended to spread out the impact over time, a number of counties are still experiencing significant percentage increases. I know the Florida Association of Counties is lobbying on our behalf to make sure that, or to ask for an amendment that would essentially hold counties harmless on excessive increases to their Medicaid costs. It didn't go through last year. I understand a lot of bills didn't make it last year. We'll cross our fingers and see how it happens this year. Healthcare Responsibility Act. Section 154.301.316, Florida statutes. This one goes back to 1977. Essentially, the Healthcare Responsibility Act was put together because you ended up with a situation where there was one hospital covering essentially a large area, multiple counties, and that hospital happened to be on one side of the border of one county, yet it served a lot of the indigent population in a county where the hospital didn't exist. So in order to balance that out, the rule came into play where if an indigent person in your county seeks out hospital services, emergent or not, in a hospital outside of your county is responsible for the payment of that bill. Now, that last line, cumbersome process, huge cumbersome process, because what this requires is that the hospital then recognize that they're dealing with a person who can't pay, that they have an indigent person there. They have to send a bill to your county. You then have to get in touch with the person who receives services at the hospital. There is a huge eligibility process to go through. It's all very time constrained and very prescriptive, written into the administrative code. And you're going to have an expert in your county who does this. Pinellas County, rather populous county, we do probably 20 of these a year. You'd think that there would be a lot more, but essentially we have a lot of hospitals within Pinellas County. And if you're looking for services on an emergency basis, you're going to generally go to the nearest place. So I don't see the larger hospitals or the larger counties with a lot of services within their counties seeing a lot of this. I do see some smaller, more rural counties having to see more of this HCRA bills, but we all have to deal with them. The legislature revised the act to allow counties to use up to half of their HCRA funds to reimburse eligible in-county hospitals for indigent care. This is good if you're spending out your maximum HCRA. Your maximum HCRA obligation is $4 per capita. So if you're spending out your $4 per capita every year, you may consider, instead of sending the dollars to out-of-county hospitals, to take half of your HCRA obligation and give it to hospitals within your county to help offset indigent care costs. Keep the dollars at home. Then your obligation reduces to $2 per capita, and essentially you pay the bills as they come through. When you hit your $2 per capita maximum, you're done. Some counties require an interview with the patient to determine eligibility, as well as other documentation. In most cases, the majority of applications are denied because the patient never shows up or they don't meet eligibility requirements. Elective or non-emergency admissions or services need to have prior written authorization of the resident county. This is important. You should have processes and procedures whereby hospitals can ask you for permission to do an elective type of procedure. If they don't ask and receive approval from you to perform an elective procedure, then you're not obligated to pay. If you don't have a process to approve those elective procedures, though, the hospital can just go forth and do it and bill you, and because you didn't have the process in place, you're obligated to pay. Hospitals are required to participate in charity care at the state level, and they do have to meet a minimum amount of charity care in order to receive HCRA funding, to be able to bill for HCRA. Another one of the huge cross things between human services and public safety services is mental health and substance abuse. Section 394.76 Florida statutes requires a continuum of integrated and comprehensive services in your counties. What this is generally is that the regional behavioral health networks will give contracts to behavioral health providers within your community. By Florida statute, you're required to match some of those behavioral health contracts. You at a local level, not necessarily you at a county level. These are a local required match, not necessarily a county required match. In fact, counties are the payer of last resort. So if the provider has other sources of contributions, United Way, for instance, or patient services, fees, or any other form of revenue that they can use, they should be using this money first as a match on these grants. You as a county are then obligated to make up the difference. Now, what's helpful is that a schedule identifying the agency's funds available for match is typically included within the agency's audited financial reports. So if your human services manager who's managing these contracts should be getting their annual audit reports from these agencies and checking to see what is the otherwise available local match available within these organizations. If they have, then your obligation goes down. I can tell you though, Pinellas, the state of Florida is per capita, one of the lowest funded states in the union for behavioral health, substance abuse. So as a human services person, I would hate to see a lot of money being pulled out of behavioral health services. So even though it may not be an obligation under Florida statutes, it still may be a good idea to put money into behavioral health services. It helps reduce jail populations, it increases capacity, it helps with family continuity. You probably know the stories better than I do. Residential and case management services which are funded as a part of a deinstitutional project shall not require local match. The state and federal financial participation in Medicaid earnings does not require local match. And funds for services that were provided through the Children, Youth, and Family Services budget prior to being combined with SAMHSA, Substance Abuse Mental Health Services, also does not require a match. Auditors doing the audits of these provider agencies know these rules, and they help identify which contracts require local match and which don't. Section 39.303 through 304 Florida statutes. Children's medical exams. We see counties are required to do a lot. I mean, we get into a lot of things. We are required to provide the initial examination for children who are allegedly physically or sexually abused, abandoned, or neglected. Section 39.303 requires Children's Medical Services in Florida to develop and maintain coordinated services, the child protection teams, essentially. This is the rule that requires child protection teams to be established. I know in Pinellas County, child protection teams are put forth through the sheriff's office and a combination of the sheriff's office and a behavioral health specialist working together. It does require collaboration with the Florida Department of Health, Department of Children and Family Services, interagency agreements, establish protocols and operations, and etc. 39.304 discusses the circumstances in which medical exams may or should be performed. And 39.3045 requires the county of residence to bear the initial cost of the exam. In Pinellas County, we have two contracts in human services. One is our mandated program, we call it Help a Child, in which we contract with a services agency who does all of the exams for the children's medical exams. This covers children up through, I believe, age 13. We also have another contract, which is not mandated, but I encourage all counties to have this. It's our SAVE program, and that's for sexually abused, and that would cover children in my case, from above 13 up to adulthood. This was touched on in by the previous presenter. Juvenile detention. Predisposition. Section 985.686 Florida statutes. And prior to 2004, the state of Florida paid 100% of juvenile detention. Everything. The facilities are operated by the Department of Juvenile Justice. So they are, another thing is that, although we're now, since 2004, required to participate in the cost of providing this service, similar to Medicaid, counties generally have no ability to, or don't participate in the actual provision of the service. So we have very little ability to affect the costs associated with this. Essentially, you get a bill and you pay it. A couple slides, I'm going to get into some ways that you might look at it. I'm sure many of you are. But this cost sharing enacted in 2004 essentially said that counties are required to pay for juvenile detention days, children in juvenile detention, prior to disposition, meaning prior to them going before a court and getting their case disposed. Department of Juvenile Justice pays for post-disposition days. So if the child is in juvenile detention after the disposition date, the state pays for that. State pays for out-of-state children, and they also pay for physically constrained counties. So the state picks up the cost for physically constrained, out-of-state, and all post-disposition days. Similar to Medicaid, again, for years we had problems with the billing systems between the state of Florida billing the counties for their share and the participation of costs. For years, counties disputed the billing methodology. In June 2013, and this dispute went all the way to the courts again, in 2013, the First District Court of Appeals ruled that the Juvenile Justice misinterpreted Florida statutes. Also, the court determined the Division of Juvenile Justice or Department of Juvenile Justice was not billing actual costs and also billing based upon post-commitment, not post-disposition. Essentially, read your statutes. In April 2015, the Division of Administration hearings, another judge, ruled on the methodology used in preparation of juvenile detention cost share billings. I bring these up primarily because there has been a lot of activity on this issue recently. And activity on this issue, especially at the judge's level, when it percolates down, it's going to mean some pretty dramatic cost swings that are going to be seen by our counties, especially when it comes to the definition of what's pre and what's post. At the beginning of each fiscal year, an estimated allocation of funding is calculated and billed to each county based upon the prior year's utilization. After the fiscal year is closed, a reconciliation of actual utilization and costs is done to determine the actual amount owed by each county. Adjustments are supposed to be made to each county's account balance based upon their actual utilization compared to estimated utilization and cost figures. The changing interpretation of what is a pre-day versus a post-day has resulted in significant impacts. I can tell you, Pinellas County, our fiscal year 2014 bill for juvenile detention was about $2.1 million. This year, I'm under budgeted because the bill came in at $4.1 million, almost double. If you look at the ratios that are up on the chart here, you'll see it's really been about the changing definition of what's pre and what's post. At one time, the ratio of pre versus post was 32 to 68. Now it's 64 to 36. I also included what was paid by the county versus the state, because like I said before, the state picks up the cost for physically constrained counties and out-of-state juveniles. But a couple of years ago, the counties were paying 30% of the bill, the state was paying 70% of the bill. The estimate that came down in July put the counties at 60% of the bill and the state at 40% of the bill. Three counties have actually, and these are some options that we have, and 3 counties have actually opted to operate their own predispositional detention centers rather than sharing the cost of the state. Now, there's positives and negatives about that. Please talk with your county attorney, because taking care of juveniles is not always an easy thing. Many counties have invested in community alternatives to secure detention and other programs including prevention, intervention, and diversion activities. I know Pinellas County spends a lot of resources looking at diversion activities, looking at alternatives to incarceration, to alternatives to juvie, ankle bracelets, home arrest, that kind of thing. Litigation continues over billing issues. Side also, the current process really doesn't give counties a lot of input or oversight outside of what's called the regional circuit advisory boards into the budgeting for the Department of Juvenile Justice. So if you've got an opportunity to get some staff looking at that, it might be worth your while. There's a lot of dollars tied to this kind of stuff. All right. Last section, county health departments. County health departments are going to vary. If you've been to one, you've been to one, because they're not the same. They play different roles in different counties depending upon the needs and what your county, the size of your county, the population that you're looking at, the different impacts of disease and medical needs in your county. In Pinellas County, we've got a great relationship with our health department. They actually run our medical homes, and we have a indigent healthcare program. And I meet with my counterparts and director weekly to go through our operations and such. Like I said, it's a terrific relationship, and I hope that kind of relationship carries across to every county. But although they're very different, they all have a couple of basic things that are standard. Infectious disease includes things like surveillance, diagnosis, treatment, partner elicitation, and contact tracing. Really important. I mean, it was only a year ago or so that we had this Ebola scare, and I'll tell you, our health department put everything into this to make sure that, Pinellas County, with our airport and our shipping and everything, we keep a cap on this. Don't let it get crazy. Basic family health care services includes treatment for minor illnesses and injuries, prenatal care, family planning, well child services, school-based care, dental care, environmental health services. Oh, let's get the slide up. Right here I'm talking to you and I want the slide moving. Environmental health services includes a lot of different things, inspections, sewage, group care living facilities, private water wells. They also work closely with the Department of Environmental Protection. Part of the role the counties play with their health departments, and I guess a year or so ago, they went through a little identity crisis, and you're going to hear me call them county health departments, but I understand now they like to be called Department of Health in such county, in our case, Pinellas County. So, but we still call them our county health department. And one of the things you do as a county for your health department is you provide them with facilities. So the county health department actually works out of a county operated and owned facility. Well, a county owned facility. It's typically operated by your health department and maintained by your health department, but the building itself, the land, the fiscal assets are owned by the county. There are state and local partnership, like we said, and they work closely with their hosts, you, the Board of County Commissioners. And you're going to, at least once a year, see this huge contract that's going to come across from you, which is your funding for your health department. And there's a lot of detail in there, and that contract essentially establishes your relationship with your county health department. It establishes how they're going to earn their funding. They include funds from county funds. Counties have the option of being able to do real estate tax to help fund their health departments. Health departments fund a lot through fees, those inspection fees and those kind of things that we mentioned earlier, the environmental stuff. And the state of Florida also participates in the funding. So you're looking at a mix of funding from state, from county, and from fees that all together help fund your health departments. Things to watch out for. Anything that's going to change that relationship between your health department and your Board of County Commissioners, you want to watch that. Counties have, like I said, it's a partnership, and when one partner is impacted, both partners are impacted. County health departments are there have been some state reductions, that state piece of the pie that funds health departments, to all these health department trust funds. Sometimes when the health departments don't spend their trust fund, it gets swept back up to the state of Florida and reallocated out again. County health departments are moving away from the provision of primary care, something that could be really disastrous for rural counties, where your health department is a major provider of primary care. Pinellas County is an urban county, but I can tell you our health department is a major provider of primary care within Pinellas County. We've got enrolled 10,000 people a year that go through our health departments for primary care. And moving our health department away from that primary care provision of services would be traumatic. I'd also like to mention the impact of the Affordable Care Act, something that I know our legislature has been wrestling with for the last couple of years. And that impact, however it goes, whether it gets passed or it doesn't, expanded medical services or not, the Affordable Care Act is going to have and is having an impact on healthcare throughout this nation. And your county health departments are part of that. A plug for the Florida Association of Counties Human Services Administrators. It is our mission to educate and advocate. It's what we do. Get involved. Annually, we do a survey of all the counties to collect information. I'd like to get 67 counties involved in at least providing us information about what the costs of services to be provided in your counties. And any questions? Yes?
How do you see the future funding for rural counties where this need is so desperately needed, but yet we keep getting diminishing money from the state?
It's, I can't fathom the Department of Health actually pulling back from the delivery of health care, but it keeps happening, and I am surprised every time I see that happening. I honestly don't know. I am a big advocate myself, just from what I've seen, and I see things from a different perspective. I agree. I recognize that. But expansion of Medicaid within the state of Florida, I think is huge. And it's just, I don't see it happening right now with the legislature, but I can see it being a huge benefit to the state of Florida. It's politics, I get it. I try and stay out of it. But that is the one thing that I can see that might help. Outside of that, I know the intent is to pull the health departments out and allow federally qualified health centers and private providers to step up to be able to provide services where the health departments really shouldn't be, in some people's opinion. We don't see a lot of people opening up healthcare for indigent. It's not a winning proposition, honestly. Federally qualified health centers live on a margin. They have 50% of their money comes from, is written off. 50% of their services are written off as uncollectible every year, at least our local one in Pinellas County. So, I mean, they're living on a margin. If we took a lot of people who can't pay their bills and just left them on that, it would sink any provider. I just don't see the provision of certain services like health care for the indigent coming from a private sector entity.
If I may, one other thing, we had a magnificent operation, Highlands County,
Mm-hmm.
that took care of dental problems to a great extent for a lot of children in our county that were in desperate need at a time when they really needed it and should have it.
Right.
And that keeps getting less and less assistance and really people looking at it properly.
Pinellas County, same way. There actually weren't any pediatric dentists in Pinellas County. I mean, we're talking a county of almost 1 million people. There weren't any pediatric dentists taking Medicaid. The health department was the only one. And because it's a losing proposition. I mean, if there was money out there for it, you would have people knocking on the door, but they don't. Our Board of County Commissioners, bless them, put $500,000 extra last year into dental initiatives. We're finding more money this year through our federally qualified health centers to put in more money into dental. Dental has a lifelong impact from children, adults. I mean, your teeth turn to chalk. You get all kinds of heart problems, liver problems. I mean, it just gets crazy. I mean, talk to any doctor. I mean, some of the first things they do before they go through for a heart situation is just go in and pull all their teeth, because their teeth keep sapping poison into their body and makes them sicker. And there's only one way they're going to get better. And unfortunately, when it gets to that point, all you can do is pull all their teeth and give them dentures.
Thank you.
One
Yes.
last question.
Yeah.
Interestingly enough, this is of course, a big topic for most counties in Florida is healthcare. And what I have found is that the word indigent seems to have different definitions. It's never the same. I found that very interesting. And the other thing is that there aren't a lot of good answers out there on how to handle this problem. When I was growing up, we were very poor, but we always paid at least $10 or $15 a month to a doctor or hospital, whatever, if we had to have something done. So is there a clear definition of the word indigent? Because I think it depends on where you live, what county you're in, as to what that definition is.
Yeah. We use the HRSA definition of poverty level, and there are variations on poverty level. Hospitals use charity care definitions, but essentially you're correct. It means different things in different company. Hospitals, charity care goes at 200% of federal poverty level. Pinellas County runs its operation at 100% of federal poverty level.
What is the poverty level? Is it 135?
It's going to vary by your area, and poverty is going to change, but you got me. I can't.
Federal, I believe is
Yeah.
what I think.
I believe so. You have poverty level as one main indicator. Like I said, hospital charity care thresholds. The Affordable Care Act came in and essentially put Medicaid at 133% up to 138% of federal poverty level. So different thresholds are in place for different situations. HUD has, but most federal agencies follow the federal poverty level guidelines. And I can tell you, Pinellas County, we generally have historically looked at 100% of federal poverty level. We had a potential, when we were looking at expanded Medicaid in the state of Florida, we were looking at expanding that up to 138% of federal poverty level, but didn't happen, so we stayed. But you're correct. You're looking at, depending upon who you're talking to, whether HUD, CMS, county, Affordable Care Act, again, hospitals, you're looking at different definitions of what's considered indigent or charity.
I think that's part of the problem. I think we should have a definition and be more consistent across the state.
Yeah, and
It's a huge problem for the whole state.
yeah, I know HUD also looks at like median area income for different definitions of, whether or not you can get affordable housing and such. I also worked in community development area and that kind of thing. They got different strategies. A state housing program uses very low income, 30% of federal poverty level, that kind of thing. But sure thing.